and welcome to a new episode of the Daily Update. Today is July 23rd, Thursday. On this show today, we have Lloyd Phillips.
Good afternoon, everybody. Thank you very much, Ray. Well, today will be fairly brief. I just want to touch base on a few issues that we want to relay to the community. On some information that we've been looking at, some of the things that we've been analyzing just a little bit and seeing how things around the world, throughout the province, have potential impacts right here, in Kahnawake. I guess, the key words for today, would obviously be, takeaway messages would be about being careful and about being mindful of our surroundings. Because there was some lectures that we were watching that originated from McGill University, and they were talking about how an impact of a potential second wave of the virus, how would that impact on the province, on Canada, and obviously how that would impact us, in the community. So they had some ideas and some thoughts on how we could minimize the impact on any society, for that matter, if there is going to be a second wave. And one of the things that they underscored is the fact that the virus is still in control. Even though we are at a very low point right now, the infection rate generally is still very low. I have some more comments on that in a minute. And death rate is real low. Ultimately, the virus still has its grips on society. It still has grips on everything that we do, because it can very easily come roaring back, and it could put us back in a situation similar to what is happening in the States. And one of the concerns and one of the things that they did was they did study what is happening in the U.S. and how that example is obviously the example that you don't want to follow, and how we could prevent major outbreaks as that we're seeing. If you watch the news, you see California and Nevada and Arizona, Florida. There's many areas that are having major outbreaks, and it seems to be the southern states, but gradually working its way north in terms of more and more states having major outbreaks. So, what they are seeing a lot of in this scenario is there was a lot of, I guess, science that was ignored, and there was a lot of information that was raising many red flags to the states and saying, slow down on your opening, make sure that you're assessing each step as you move forward, which basically they ignored. And the way it was framed, it was like there was many red lights, that were there, but they maintained cruise control and just kept on going, and ignored the science. And now what we're seeing with the major outbreaks and the resurgence of the pandemic in the States is proof that they had ignored the science. And I guess the lesson that we could learn from that is the impacts and the things that we do now impact the future, and more importantly, the decisions and actions that we do today impact on what a potential second wave could look like. The more precautions we take, the more serious we take precautions, the stronger we maintain certain measures and certain protections, to minimize what a wave of a second wave could look like, and we potentially minimize the impacts. Obviously, there's nothing that is guaranteed, but that's certainly a really important area for us to consider, because even though we may feel at this point a level of security, a level of calmness, it can easily come roaring back. So our actions today definitely impact what happens in the weeks to come. For example, in Quebec, since June 30th, when pretty much everything opened in the province, the daily infection rate was around 75. So the weekly average was about 75 cases per day. After 3 weeks, those cases have doubled. So there's still about, say, roughly 140, 150 on average, and for average weekly daily average, which compared to looking back a couple of months ago is very low, because I know at one time we were looking at thousands in a day. Even though those numbers are still very small in the big picture, 150 or so on a daily on an average week, it still has doubled since the opening, and the trend over the next while seems to be going in this gradual increase, which tells us again that we should be very careful, very mindful of our surroundings, and ensuring that the measures that we put in place, and we talked about time and time again regarding hand hygiene, about distancing, and of course recently wearing masks in public places, indoor public places, are maybe the main three pillars in which help minimize the spread of the virus. Because we see things happening around us. It's not directly impacting our community at this point in time, but as we all know, we don't live in a bubble. We don't live in our own silo. We are part of the greater society. So we have to be mindful of what's happening around us, so that we can take the proper precautions as a community to make sure that we do take these things seriously, and have and that's the rationale for the task force to really look very closely at some of these numbers. And the death rate in Quebec has been 0 for the past couple of days, which is obviously great, and the death rate has been lower over the past few weeks. But one of that obviously in itself that's a very good thing. But what a group of epidemiologists has studied not only in Quebec but around the world, and seen how with the increase in cases, there's usually a lag time of about 3 weeks where before you start seeing another increase in the death rate. And right now in Quebec, there's like gradual, small incremental steps, and the cases are increasing. So we have to be mindful of that. If that trend continues, the Quebec area, could start seeing increased cases of death, if the rate keeps going in that way. And one important point to note is that in the past, I guess part of the pandemic, I'll put it that way, a lot of the cases, a lot of the infection rates were linked to long-term care facilities, old age home type environments, where we know that it was a rampage to those areas, and many deaths came out of that sector of the population. But this time around, it seems a lot of the new cases, the new outbreaks that we've seen recently in the past couple of weeks, but we see across Canada, are linked to gatherings. People who are gathering in uncontrolled areas, people having parties, people going to bars and not distancing, and so on and so forth. That seems to be the new area where outbreaks are happening, and that's the area that we certainly have to be very mindful. And as you probably heard already, a lot of the people who are being infected are younger people, 40 and under, who as we all know, generally do well if they get the virus. There's no guarantees. There have been deaths of people who were young, and people have very serious repercussions and problems after having the virus, even though they were young. But so we have to be mindful of that. But now, those young people going home and possibly infecting other people, parents, grandparents, and so on and so forth, again, is an area that we have to be mindful of, and have to be careful, because even though we may feel, or you may feel no more secure as a younger person, there are people who are still very, very vulnerable to the COVID-19 virus, and it's something that we have to remain very vigilant and keep in mind of your surroundings moving forward. We are still in the process as a task force of rolling out the implementation of the continued reopening of the next phases within the community. But we also, again, have to be very mindful of what's happening around us. And in order for us to get back to whatever the new normal is going to look like down the road, we need everybody's cooperation to ensure that we get down that path as smoothly and as quickly as we possibly can. Right now we have great compliance, great cooperation from the business people and the community members as well, in terms of the recent directive on masks and people maintaining the distancing and minimizing people within the space of their stores and so on. Really excellent work done there, and that type of attitude and that type of cooperation is what's gonna help secure and keep our community as safe as we possibly can. But that same type of attitude and that same type of cooperation has to apply to each and every one of us when we leave the community. Because we all been out, various places taking care of either for business or for pleasure to get out and do different things. You have to be mindful as well, that not everybody out there cares as much about the health and well-being of their society as we do as Kahnawake-Odawa. So obviously, you wanna keep that in mind. The thing we have to keep in mind, again, gatherings. As we speak today, a household gathering is still limited to 10 people. Social distancing rules still apply. And if you're going to go indoors, it's highly recommended that people wear masks. In private residence, it's not mandatory, but certainly it is something that is recommended. Public gatherings, it's still limited to 50 people. That's a maximum that is felt that is comfortable at this point in time. Same thing applies in terms of masks when appropriate. Distancing and hand hygiene are again the three pillars in which we have to keep re-emphasizing, because that's what's going to again help keep us safe. And that, as I mentioned, is the area that we're seeing across Canada where outbreaks are happening is amongst gatherings. We have been very fortunate in our community. And we want to keep it that way. Recently, there was an increase in testing at the testing facility, and actually people coming in who had COVID-like symptoms. But fortunately, as we speak today, all the tests are negative, and we do not have any active cases in the community. And we want to do our darndest to keep it that way. So if everybody's cooperation, continued compliance, continued working together strongly, we will minimize any outbreaks. We will try to eliminate as much as we can any outbreaks in the community. So with that, we just want to say once again to keep up the good work. The task force is continuing its planning into the long term. As I spoke on the radio this morning along with Lisa, we are putting together a plan that would address any outbreaks that would, if we're looking down the road at a potential second wave of the virus, which I'm sure people are hearing a lot on the news, that we are prepared properly and able to address it in a clear, concise manner and various steps that we know what has to happen at certain times if we go down that path. Keep in mind, these are plans that are being developed, honestly, with the hope that they'll never be used. If things could develop and be maintained the way they are, there will be no need to increase measures, have additional directives, and so on. What we also know we have to be prepared. We have to know what's ahead of us, and we have to know how to respond appropriately as a community if and when that time comes. But in the meantime, we're maintaining our monitoring. We're maintaining what we need to do to keep our community safe. And with that, I'll leave you to Raymond, and I'll see you again soon. Anigawahi.
Yeah, well, Lloyd. Just a note about the test results from the testing facility. All the results that we have received to date are negative. We're still waiting on some results to come in. Okay, moving on from that, we just have a few announcements to make. We're asking all of you to check out Kahnawake 911 for the announcement of the winners of the show. Show us your mask. Winners of the Show Us Your Mask contest. Excuse me. Winners will get a Shop Kahnawake gift certificate. Also, look out for a new video on where you can get masks in Kahnawake, featuring how you can get a custom designed mask. Several organizations have ordered their own masks with their logos for their staff, including KSCS, KMHC, and the MCK. So thanks to those who are looking out for their workers. And with that, Ganawage, let's be careful. See you next time.